Good evening all, I'm Aditi Lamba with the Tues edition of South Asian News, Vision of Asia. We are coming to you from a studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic. Globally, we are looking at 67.8 million cases of the coronavirus with 1.5 million deaths. In the United States, we have surpassed now 15 million cases, and the death toll from COVID-19 in the US is now 284,000 and counting. The number of new daily cases yesterday was more than 203,000 cases with more than 102,000 COVID-19 patients. The country is currently averaging about 2,237 daily coronavirus deaths. To make the matter worse, healthcare providers as well as experts expect the spread of coronavirus to worsen, anticipating new waves from December holiday gatherings on top of a potential surge from Thanksgiving. On that, nation's leading health expert Dr. Anthony Fauci said that as we enter now from Thanksgiving to the Christmas holiday season, it is going to be challenging. Meanwhile, U.S. regulators moved a step closer to approving COVID-19 vaccine on Tuesday as Britain started inoculating people, offering hope of slowing a pandemic that has now killed 15,000 Americans in just last week. On vaccine, Pfizer Inc. cleared another hurdle today when the U.S. Food and Administration released documents that raised no new red flags over the efficacy or safety of the vaccine it has developed with Germany's BioNTech. Healthcare workers are now expected to be among the first to receive the vaccine if it is authorized. In politics, talk of a new stimulus package continues, with Congress delaying a fresh infusion of aid to families and businesses reeling from a pandemic that has now thrown millions out of work. Meanwhile, President Trump still yet to concede to President-elect Joe Biden, while the President-elect continues his transition process, announcing several key cabinet positions and more. So where are we headed with vaccines coming in and a new president set to take office on January 20th? We have tonight much on politics, COVID-19 and more. Here are the headlines. Veteran journalist Rohit Vyas on incoming Biden-Harris administration agenda and more, New Jersey. Mayor Sadaf Jaffer on surging coronavirus cases and U.S. politics, Montgomery Township, New Jersey. It's time for a short break, but stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lamba and this is Vision of Asia, Tuesday night episode of South Asian News. Taking a look at politics, President-elect Joe Biden today introduced the team to lead his administration's response to the coronavirus pandemic, emphasizing the mass distribution needed to achieve his goal of 100 million vaccinations in his first 100 days in office starting January 20th. The president-elect said that whatever your politics or point of view might be, mask up for 100 days. He also said that he needed Congress to fully fund vaccines to all corners of the United States, and getting children back to school will be a national priority in the first 100 days as well. President-elect Biden today introduced California Attorney General Xavier Becerra, a Latino former congressman, as his nominee for Secretary of Health and Human Services. Leading health expert Dr. Anthony Fauci was named President-elect's chief medical advisor on the virus, and South Asian American and former U.S. General Dr. Vivek Murthy will now hold back his former position in the new upcoming administration. So how doable will the mandate of President-elect be, and what do these nominations represent for the future of U.S. government? We spoke with ITV Gold senior political commentator and veteran journalist Mr. Rohit Vyas. Here's what Mr. Vyas shared with us on the incoming Biden-Harris administration. Of course, we have to have you here because so much is happening in the nation and we're really trying to understand the politics of it all. So let's begin today looking at what President-elect Biden is doing. He has announced his healthcare team, those main key members who are going to lead the coronavirus pandemic task force, key members that are truly going to try to handle this pandemic. What are your initial thoughts about it? And before you answer that, I want to go over what President-elect Joe Biden basically stated as an agenda for handling coronavirus. He wants to distribute 100 million vaccines in the first 100 days after becoming the president. He wants a mask mandate for 100 days after becoming the president. And he also wants most schools to be open if Congress will provide funds. Do you think it's doable, what he's saying?
Yeah, it's all doable. He doesn't want a mask mandate, by the way. He's just made a request to Americans that from the day he is sworn in, he is requesting the American population to please mask up for 100 days and no more than 100 days. And he says it's to get us over this period, which is going to be a very rough period until everyone starts to get vaccinated on schedule. As to his team, the health team he has announced is superb. The health secretary is someone we're going to have to look at a bit more closely because he is California's attorney general who has been dealing with a lot of the Trump matters or going after the Trump campaign and Trump himself on various issues in the state of California. As to the other members of the team, they're all scientists, they're all professionals. You know Dr. Vivek Murthy, an Indian American, a very, very highly qualified individual from the medical profession, who's back in the role of Surgeon General. You have Dr. Anthony Fauci, who President-elect Biden requested to stay on with him and is now going to be his chief medical advisor for COVID-19, and probably will be retained for many other issues as well in the medical team. So a very good team as far as I can see. I think President-elect Joe Biden has been very systematic, very careful in the kinds of people he's been appointing. His intended defense secretary, also a good choice, someone he has known personally for many years, namely when he was vice president, and when the lieutenant general in question was accepting the handover in Iraq and was responsible for a lot happening in that region. The only thing is he's going to need an exemption because you are not supposed to be serving as a civilian defense secretary unless you've gone past 7 years of having been retired from the Army or the Armed Forces. For him, it's been, I think, about 4 years or even less. And so he's going to need an exemption, which is not unusual. That happened in the case of President Trump's defense secretary choice. He was given an exemption by the Senate, and it should happen in this case, but it could be contentious simply because the Senate majority, as of now, is in the hands of the Republicans, so they can tend to be difficult with confirming this choice of a defense secretary. But of course, it's historic because it's the first African American, the first Black American defense secretary, and a very significant choice in that respect.
You know, in his nomination, President-elect Joe Biden has a lot of diverse individuals, but he's focusing on first of many. Could you explain to us why you think he's focused so much on first of many? Is it his way of showing inclusivity and dignity for all?
It's his way of understanding America, I think, better than most politicians have understood America. I think Joe Biden has worked with so many different people from so many different ethnic backgrounds, so many different colors, if you want to use that term. He knows everybody, white, black, brown, from wherever they are. He's dealt with so many folks on the international stage. So he understands ethnic backgrounds. He understands different types of cultures. He understands the different types of people. And therefore, he understands America because America is a melting pot of all these various cultures, these various ethnic backgrounds, these various people. He understands America, I think, like no other leader. And he's showing that in his selections of individuals to represent the diversity of the country. This is a highly diverse nation, a highly respected nation because of its diversity. And therefore, he wants to show that whoever he has in the cabinet, his cabinet, will reflect America.
Yes, definitely. You know, you were talking about, last time when we were here, we were talking about the nominations and how much they could be confirmed from the last cabinet we were discussing. When you're looking at this team, how difficult do you think these nominations are going to be in terms of, getting confirmed? Which ones do you think are easier?
Yeah, some of them, I think Janet Yellen, the Treasury Secretary, is a shoo-in. She has widespread bipartisan support. There will be many others, including Dr. Vivek Murthy, who will be face no problems whatsoever in being, confirmed as the Surgeon General. I think there are many who are going to do fairly well. There will be a couple of them. One of them will be the Health Secretary elect. Nominated the Health Secretary nominee. I think will face a contentious confirmation process because of his having taken a hard line on Donald Trump. So I think he will face difficulty. The Lieutenant General who is Biden's choice for defense secretary, will probably face a contentious confirmation. Most of the others, I don't think so as of yet. Now, all of this, don't forget, also depends upon the two runoffs that we have coming up in the first week of January in Georgia. And that could shift the balance of the Senate. If that happens, there'll be less of a contentious race, but there's also the problem that Joe Biden faces within the Democratic Party itself. And that's those who lean very far left, who are not going to be with his standing by his moderate trends or his middle of the road take, as it were. So it's not guaranteed by any means that you'd find a whole bunch of Democratic senators either willing to confirm some of these nominees. So he does face an uphill task. But as I've said, the overriding benefit to the benefit of Joe Biden is the fact that he is so good at reaching out across the aisle to so many people. He has that experience. He personally knows so many of these folks. He knows Mitch McConnell very well. They know each other very well. They do talk to each other. And that would be a key factor in getting these nominations through successfully.
And welcome again. This is Vision of Asia, South Asian News segment, and I am Aditi Lamba. In New Jersey, yesterday, there were more than 3,481,000 patients in the state's 71 hospitals with coronavirus or a suspected case. That's the most number of patients since May 14th. Officials have said that 670 are receiving intensive care, with 422 on ventilators. To curb the spread, New Jersey's indoor capacity has now been limited to 25% and service to end by 10 p.m. under a recent restaurant curfew. Along with that, 9 out of New Jersey's 10 largest school districts have gone remote and won't return in person until January or February at the earliest. So continuing our presentation on U.S. politics and the South Asian American voice, earlier today we spoke with Mayor Sadaf Jaffer of the Montgomery Township in New Jersey on these surging cases of coronavirus across the nation and the responsibilities and actions of local and state governments. Here is Mayor Sadaf Jaffer. When you're looking at coronavirus and also when you're looking at elections and politics, but let's start by talking about COVID-19. I'm looking at 15 million cases in the country, 284,000 deaths in the country total today. My question to you is, how are you responding to this surge of cases currently, and how is it impacting the Montgomery Township?
We're definitely seeing an increase in rates. We've had higher rates over the past few weeks than we had at any other point in the year. And we've been reacting by, obviously encouraging the public to limit their gatherings. We've done a number of videos and informational documents with our health officers, recommending that people not engage in any sort of indoor activity. The governor has limited indoor capacity to 10 people and any sort of gathering, and outdoor to 25. So there's a lot of steps being taken, but it's still a fact that there are a lot of infections happening, and we really need to all do what we can to limit contact that we're having with anyone outside of our immediate families or immediate households.
Yes, definitely. Mayor, when you're talking to these health officials, definitely, when you're discussing this with them, what are they attributing this surge of cases to? According to you and the other health officials, what is the reason behind such a surge that we're seeing, like, in the nation today?
Well, to some degree, it's not a surprise. Everyone knew that this is the pattern, that generally coronaviruses of this sort are much more active in the winter months. And so it started really in late February, early March in the US. And so we had a few months of winter or cold weather where it was high rates of infection. And then in the summer, we had a bit of a bump, but it wasn't that severe. And now we're back into the normal sort of season where we have these types of viruses that gain a lot of infection rates. And the only way we could have prevented this was if we had been very strict earlier on. If in the summer we had limited contacts, if states had stayed locked down, but that's not what happened. And unfortunately, a lot of people still don't believe. They don't want to wear masks. They don't want to avoid gatherings. And, in New Jersey, even when we were advising people not to meet for Thanksgiving, I would see people posting like, well, I'm going to have 20 people over at my home. And now a lot of those people have become infected. And even though the CDC recommended that people not travel for Thanksgiving, the airports were still open. They were packed. I've seen the photos. So it's not enough that the CDC just put the guidance out. They really should have limited flights, enforced having the middle row be empty. I mean, there are a lot of things that government can do. It's just that our government didn't do it.
What do you think needs to be done when we're looking at, the upcoming holiday season? Christmas is such a family holiday. It really gathers a lot of people in many households. How are you looking at the next few weeks? What are some of the measures that you have to take in order to sort of curb the spread in holiday season?
Well, we are continuing to advise people not to have gatherings at all, actually, indoor, and to even avoid outdoor socializing as much as possible. I think that people need to come up with alternative ways to gather, whether it is through virtual meetings, phone calls. That is what we need to do. And especially because we know that the vaccine is on the way. It's not like February, March, where we had no idea when or if this might end. Now we see there's light at the end of the tunnel. Hopefully there's effective vaccines. So we just need to stick it out for a little while longer. I really think that the federal government should be taking much stricter measures on travel, on, enforcing testing in temperature checks, but it's just not happening, unfortunately. So each of us individually needs to do what we can to limit our exposure to anyone outside of our household.
Mayor, while we're talking about the surge of cases, I have to ask you, in your township, let's forget the state of New Jersey right now, in your township, what would need to happen in order for you to either shut it down or place a lot of curfews like we saw earlier in the year? What scenario are you looking at where you'll have to make that decision?
Well, I would say that in New Jersey, the governor's office has been pretty effective in, being very data-driven in the shutdowns that they've had. We do have cases going up, but not nearly as severely as some of the other states do. We still have capacity in our hospitals. We're not facing that sort of hospital system collapse that some of the other states in the United States are facing. So right now, as I said, the limit is very low for indoor gatherings and even for outdoor gatherings. There's been a limit on any sort of sports contact. Schools are very much virtual for the most part, or hybrid, in which there really is very little interaction happening in an official capacity. And when there are unauthorized clubs or bars, they are being shut down and they are being censored. So I don't know if there's really a lot more that could be done in New Jersey other than people just being very careful about wearing their masks at all times, not socializing. As I said, a lot of the cases that we're seeing now are from private gatherings in people's homes. And it's very hard to actually know if people are having 15, 20 people over at their home. So that really does fall on the public to actually abide by the guidance that the public health officials are putting out.
Well, this is all for tonight's show. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for popular access to many of our shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.